My name's Lauren, and this is my anatomy bone video. So this is a clavicle. It is a left clavicle, and the way you can tell that is there's going to be a rough end or a rough edge on the bottom, and it's going to be smooth on the top. So this is the sternal end because it's the medial end, so it attaches to the sternum, and then the acromial end is the lateral end. This is the scapula. It is a right scapula. This is the lateral border, the medial border. This is the superior border, and this is the superior angle. This is the inferior angle. The glenoid fossa is right here. And this is the acromion process. The spine. This is the coracoid process. The supraspinous process is right here. The subscapular fossa is here. And this is the suprascapular notch. And the infraspinous fossa is on the front where the body is. So this is a humerus, and it's a left humerus. This is the head. Then we have the anatomical neck around this area, all the way around. Here is the greater tubercle, the lesser tubercle, and this is the intertubercle groove, or the biseptal groove. Here we have the deltoid tuberosity. It'll be rough. And then there is the lateral epicondyle, the medial epicondyle. This is the trochlea. It goes all the way around to the back. And this is the capitulum. Here is the coronoid fossa, and this is the radial fossa, this little area, this groove fossa. And on the back you have the olecranon fossa. This is a radius. It is the right radius. Here is the styloid process. It points towards the big thumb, the thumb. Then you have the head of the radius. Here's the neck. And this is the radial tuberosity. So this is an ulna. It is a right ulna. The styloid process points to the pinky. Here's the head of the ulna. This is the trochlear notch. This is the coronoid process, this little sled type thing, and this is the olecranon process, and the radial notch is right on the side. This is the hand, and there are 8 carpals. There's a proximal row and a distal row. The proximal bones are the scaphoid, the lunate, the triquetral, and the pisiform. The distal row is the trapezium, the trapezoid, the capitate, and then the hamate. These are the metacarpals, and then these are the phalanges. So we have, when numbering in an anatomical position, you start from the most lateral, so the thumb would be 1, 2, 3, 4, and 5. On the pollex, it has a proximal and distal, but on the rest of the phalanges, there is a proximal, a middle, and a distal. So this bone is the scaphoid. It has an S shape. Then we have the hamate, and you can tell that by thinking of a hammer. And then this is the pisiform. It looks like a P. This is a pelvic bone or a hip bone, and it is a left hip bone. There are three major parts. There's the ilium, and then that's the superior part, and then the ischium is the inferior posterior part. So this part down here is the ischium, and then the pubis is the interior anterior part, this area. So on this we have the anterior superior iliac spine, then we have the anterior inferior iliac spine. On the back there is the posterior superior iliac spine and the posterior inferior iliac spine. This part right here is the iliac crest, this whole part. And then you have the iliac fossa, which is this area, the acetabulum, and this back here is the iliac spine. You have the ischial tuberosity, and this is the ischial ramus. This is the superior ramus and the inferior ramus. The pubic symphysis is right here on the edge of the pubic crest, which is right here. And then the obturator foramen, and we have the iliac, or the greater sciatic notch and the lesser sciatic notch. This is a femur, and it's a left femur. This is the head. Then you have the neck of the bone. Here is the greater trochanter, the lesser trochanter, and on the back of the bone you have the intertrochanteric crest right here. It's this line right between that, and on the front you have the intertrochanteric line. So then there is on the back there's the linea aspera, the gluteal tuberosity, which is rough, and there are this is the lateral epicondyle, the medial epicondyle, this is the lateral condyle, which wraps around to the back, and the medial condyle. This is the patellar surface, and here is the intercondylar fossa or notch right here. This is the patella. It is a right patella, and the way we tell that is laying it on a flat surface and pointing the apex away from you, which is the bottom of the patella. So it's going to lean to the right and not the left. This is the apex, and this is the base. This is the tibia. It is a left tibia. The medial malleolus is this part right here. It's the pointy part. You have the anterior crest on the shaft of the bone, and then there is the lateral condyle and the medial condyle. This is the tibial tuberosity, and here is the intercondylar eminence. This is a fibula. We have the lateral malleolus. This is the shaft. This is the neck. And then we have the head. So this is a foot, and there are 7 tarsals. We have the calcaneus, the talus, the navicular, and the 3 bones right here are the cuneiforms, and then the cuboidal. These are the metatarsals, And this part, the distal part, is the head, and the proximal part is the base. With your foot, you number medial to lateral. So this the part of the hallux and the metatarsal will be 1, 2, 3, 4, and 5. So this is the hallux, and on the hallux they have a proximal and distal bone, and then the rest of the phalanges have a proximal, middle, and distal. So there are 3 different arches for the foot. This side has the lateral longitudinal arch. This is the medial longitudinal arch. And then this right here would be the transverse arch. There are 3 different bones in the foot that are important. This is the calcaneus, which is what forms the heel bone. This bone is the navicular because it's boat shaped, so think of navy. And then this is the talus, which goes right below the right above the calcaneus.